Social Prescribing is a project that explored how design knowledge can help organizations navigate the uncertainty of complex new endeavors. This was a project that was held in collaboration with the Center for Arts and Medicine at the University of Florida and Social Prescribing USA.
In social prescribing, doctors and clinicians prescribe community activities like a social group, art class, volunteering event, nature walk, or social services, activities that can promote well-being. Social prescribing commonly involves a patient connecting with a community navigator or social worker who interviews them and co-produces a social prescription that matches the person's interests and needs.
Design for Social Prescribing is a first-of-its-kind convening in the United States, which brought together 40 leaders from 9 sectors, including government, academia, arts and culture, and healthcare, sectors that normally don't work together. We brought these sectors together and used design frameworks, which helped participants challenge their assumptions, reframe issues related to rolling out social prescribing in the U.S., and broaden our understanding of the issues that diverse actors face, including funders, providers, community organizations, government, insurance companies, and patients.
But the point here is to really think about it critically as what is the interventions, what are the points that we bring need, and etc. The benefits of working through frameworks and working through the structure, a visual structure of thinking about different content areas. I hope that with a little bit of exposure and the experience that we had here, we are a little bit exposed to new ways of working through things or new ways of seeing things, and that can help us move action in a different direction.
So what we focus on with social prescribing is that connection to the local community, the going beyond pills to understand what truly matters to the individual in front of you so that you can focus on a model that is not just based on sick care and short-termism, but it is based on bio-psycho-social support for the individual and the local community.
Forget about social prescribing. This is about humanizing medicine. It's medicine beyond medicines.
Well, I think it's a new model of care. It's an opportunity for us to look collectively at how we look at health. You know, so much of what happens in the healthcare system happens outside of the healthcare system. So medically, what drives people to the doctor isn't always what's happening medically. It's more about the social needs. So why not prescribe social wellness?
I'm here to learn about 2 types of change, I suppose. Incremental change in terms of what should next steps be for the social prescribing movement, and also together with all the great leaders that are gathered here, what is the leap change? How can we reimagine the future for the movement of social prescribing?
All of this stuff, there's not going to be someone who's going to come and do this. We have to do this. We are the beginnings of this movement.
For me, coming into a different country, seeing how things work here in the US and seeing how diverse it is across states or across regions is a good reminder that there is no one way to do social prescribing.
So particularly in the context of music and health, this is our blue sky idea. We would like to see social prescription of art forms or music-based intervention be recognized into the healthcare system.
There's a lot of reasons why we need social prescribing now. Most generally speaking, I think we need a means for achieving health equity in this country and for ensuring that everyone has access to resources to support wellness and well-being.
So I think design has the unique opportunity to understand what are the contributing factors to inequities and then be really creative about how we might change infrastructure to eliminate that disproportionality. So, right, what new policies do we need to have? What new organizations need to exist? These community organizations that will carry the weight of social prescribing, particularly in Black and brown communities that are underfunded.
One from this group is going to come here, one from this group is going to go there.
I think the fact of this happening is as important as any output that we generate. coming together makes it real. We've made it real. We've made a step forward coming together as a community here. And that doesn't go back in the box. People will know that we've met. They'll see that something's happening. And then we'll continue to snowball. We'll keep generating momentum.
It's been fascinating to see stakeholders group interacting with each other. And I don't think we've missed a stakeholder group. We've had people with lived experience. We've had clinicians. We've had academics and researchers, funders. We've had people from all walks of life contributing to this workshop. And for me, the most eye-opening element has been that the focus has not shifted. The focus has been all the way on the patient, who should be at the center and who should matter the most.
We often forget to tie it back to people's aspirations, to what are the actual problems that we have already defined. And when we start thinking about the structure, it forces us to go back and forth, and try to understand that the things that are being created really fit and help people overcome the problems that have been identified.
Social prescribing offers us a community-based ecosystem, addresses our needs by providing training, resources, respect,
and ability to act as a connector to all of these different stakeholders within this community.
Shifting, expanding the one-to-one health model to many-to-many,
where we wanted to kind of harp on the collective nature of the work.
Thinking about it as, from the perspective of the insurance payer, what is it and why is this of value?
People are really revitalized by the idea that they can change something in a way that is meaningful, impactful, changes a culture. And so I think if you're considering getting involved with social prescribing, dip your feet in. Even if this isn't the model that ends up happening, because we're constantly iterating, you are thinking about the principles that we need to carry forward if we're the ones who are shaping culture next.
And this event is just the start. Participants have gone on to launch social prescribing pilots, host events similar to this one, including one in New York City, and create a network of social prescribing focused college chapter programs and more.